I think all of us, if you're really blessed in your life, have a work or a profession that you feel passionate about. And in my choice of a career in medicine and science, I think it's important to take on large projects. And for me, that project has been building the University of New Mexico Cancer Center. That's really become my life's work, and all that building that cancer center entails, not just providing the very best cancer diagnosis and treatment to everyone in New Mexico, but driving great science, driving community outreach, training young students to go into health careers. So it's all of that, and it's been an honor and a privilege.
I think Dr. Willman has the rare gifts of being a visionary, but also has the determination and the endurance to implement her visions. Dr. Willman has created something special here.
It was an ethical imperative to provide world-class cancer treatment here in a person's home state, surrounded by the people who love and support them. People shouldn't have to travel out of our state to receive that level of health care. That just shouldn't be.
Hey, we are the institution of last resort. We don't turn patients out. Doesn't matter if they have insurance, if they don't, we treat them all the same.
So if you're coming to a center like ours, you're not only getting great medicine, there are 136 scientists here working with 105 doctors. So that mix of great cutting-edge research is assuring that the very best innovative treatments are there. And because we're one of the nation's National Cancer Institute centers, we're linked to the other 67. And if we don't have some very innovative treatment or approach, we do know who does, and we get that patient and their family to that setting and context. Providing that level of health care and that kind of science and education and training and environment allows our patient to relax and take a deep breath, because we do the worrying for them. We're sorting out that path for them. We have very different multi-ethnic populations here who have different genetic ancestries and different cultural perspectives and traditions. And so just to begin with, the different populations in our state are Hispanic, are Native American, non-Hispanic white, who are very racially diverse, Black and Asian people who live here, are affected by very different types of cancer. So figuring out how to distribute healthcare equitably in an environment of large underserved populations, patients with different cancer patterns, patients with different access to care, that live in the 5th largest state of the nation in terms of land mass is a huge challenge.
People come to Dr. Willman and knock on her door sometimes and ask, please help me, my father or my mother, my kid has cancer, and she's always ready to help, and I never seen her turn anybody down. It's actually incredible to see as a shining example of a humanitarian should behave like.
Receiving the New Mexico Humanitarian Award is deeply meaningful to me because it tells me that my community recognizes me as someone who's lived a life or had a career of service.